Hello, everyone, and welcome to our LinkedIn Live. Thank you so much for joining in today. Now, wherever you're based out of in the world, good morning, good afternoon, and good evening to each one of you, depending on the time zone that you're dialing in from. Now, we'd love to know more where you are tuning in from, so please feel free to drop in your locations in the chat. I am Hanupriya. I'm a practice director in the healthcare technology team at Everest Group, and I'm joining this LinkedIn Live from our Gurgaon office. I'm also accompanied by my colleague Devjit. He's joining in from the Bangalore office. So, I would say, before we dive into our main topic that we have for today, which is smarter care management. Now, I agree that a lot of you might be wondering, why smarter? What really makes care management smarter? And what does that mean for the overall healthcare ecosystem? Now, these are some of the questions that we'll be unpacking in just a few minutes. For now, maybe we can give everybody a moment to settle in as more attendees join. So please stay tuned and let's give everybody a minute to join.
Till then, I have a quick question for you, HP. Since you have been tracking this space for a long time, so what is new in care management as per your opinion, and what are the recent changes in prior authorization? So, it will be good if we can start with this and give some context.
Sure, let me get started. So, I would say when we talk about care management, some of the recent reforms that we are seeing in this space, right? I think one of the latest news that we heard in the talk of the town that we have in care management space is very much focused on the prior authorization side of things. Now, recently, what we saw is some of the largest US health insurers, they actually came together last month itself and they took a pledge to make big changes to this overall complex prior authorization process. Now, the aim is simple. The obviously the path is not that simple, but definitely the goal and the aim that we are trying to solve for is definitely simple. What we are trying to do is we are trying to reduce PA burden, the prior authorization burden. What we are also trying to do is once basically to reduce a lot of this PA burden, we want to talk about things like faster decision making. We want to talk about greater transparency as well. Now, what these insurers also highlighted when they came up together as part of the pledge is that they will honor existing authorizations that these patients have, even when they are switching, let's say, from one insurance plan to the other. Some of the other highlights that they mentioned was, adhering to the timelines, that is 72 hours for an urgent request, while while we have 7 days for the standard request as well. Now, one final change also that we are seeing, especially in the prior authorization space, is that they'll ensure, and the industry is headed towards ensuring the fact that at least 80% of the electronic prior authorization approvals will happen or will be answered real time by the time we reach 2027. So I would say this pledge that we all saw last month, that is definitely talk of the town as part of the care management space overall. All right, I think we do see people joining in. So maybe we can get started. I have one question for you, Devjit. Now, when we say care management, right, and we say that care management is evolving or care management is becoming smarter, what exactly defines a modern or a smarter care management ecosystem in the current landscape of times?
Again, great question, HP. So, care management platforms have evolved over the years, and as of now, because of change in buyer expectations and policy changes, a modern care management platform in 2025 must have at least four things, in my opinion. So, it should be modular, it should be interoperable, it should be FHI ready, and it should be AI augmented. And if you ask me, care management platforms should go beyond traditional utilization management and care management functions that they are offering now. And it should focus on things like SDOH tracking, population health analytics, and even quality management in an unified ecosystem. So this is how care management space is evolving, and this would be the ideal definition of a modern care management platform in 2025, as per my opinion.
Got it. So I see a lot of pointers that you touched upon, especially fire interoperability. I would say is definitely an important area or a definitely an important segment that we are also seeing becoming a strategic focus for a lot of the healthcare enterprises as well. So now that we are seeing, care management or the overall care management space is becoming very much a strategic focus, very much an investment area for a lot of these healthcare enterprises. How do you see are their expectations actually evolving over the time?
Right. And HP, as we have been tracking this space since a long time, it is so surprising to see how fast things are changing. So maybe what was the third priority for payers and providers in 2023 might have moved up to the first one this year. So there has been a lot of this tectonic shifts in care management. But yes, having said that, 3 years ago, most enterprises were focusing on digitizing basic workflows like getting off spreadsheets, standardizing assessments, and even ensuring basic utilization management and care management processes were being tracked. But fast forward to 2025, that is now, the bar is much higher. So payers and providers are prioritizing interoperability. So payers and providers, they want seamless integration across the healthcare ecosystem, and it is not just limited to claim systems. They want it to be integrated with EHRs and other SDOH platforms also. And it is no longer acceptable for a care management platform to operate in silos. They must enable real-time bi-directional data exchange so that it will support coordinated care, and coordinated care is something which is very important right now, right? And the next priority is that what we are seeing is automation is also one of the most important priorities for both payers and providers, and that is because automation is very much important to reduce the admin burden. Then definitely good UI and user experience is also non-negotiable for both payers and providers, as they want their care managers to have a very good and seamless experience of the platform. And lastly, I want to highlight another important thing, that is they want the care management platforms to have reporting functionalities also, which will help them in reporting for head disk reporting, and which will in turn help them for star ratings also. So overall, the expectations have shifted from a build and configure platform to play, plug, and scale solution. And the platforms that are thriving today are the ones that deliver both interoperability, automation, and a good UI experience, and not just simple point solutions that was the case probably few years back.
Got it. I agree, and I completely second that. The way the landscape has evolved from point solutions to having integrated care to having coordinated care, I definitely agree this is the path forward as well. So I think we've been talking a lot about care management, and I understand and I agree the fact that care management in itself is very much of an umbrella term, right? There are multiple subsegments to it. So Devjit, when you are tracking this space, are there like specific categories, or according to you, what are the top or what are the key 2 to 3 categories or modules that you are seeing gaining a lot of adoption, gaining a lot of demand in this space in the current times?
That's a great question, HP. And we are seeing very clear adoption trends across the board. So, the first major area is definitely utilization management. So, this continues to be the most important module, especially because of increasing pressure to reduce administrative burden and also to meet the CMS 0057 mandate that you mentioned previously during our conversation. So, here we are seeing almost everyone is partnering with the Intercoal or MCG for the clinical guidelines. So, again, utilization management is one of the most leveraged module. The second is case management, and this is adopted particularly for managing high risk, chronic, or complex populations. And the third one is the PHM. So by PHM, I mean population health management. And again, population health management have moved beyond retrospective analytics, which was the case couple of years back. It has now moved to something like a real-time stratification, cohort management, and even driving proactive intervention, so that we can easily identify the rising risk group, and we can provide proactive interventions whenever there is required. And finally, quality management is also emerging as a fourth essential area, especially for payers, because it directly ties up with headis measure, right? So if you have the quality reporting, quality management module in your care management platform, it is very easy for you, very easy as well as convenient for you for headis reporting, which in turn will help you for star ratings. And as everybody knows, because of star ratings, it directly impacts the top line of the payers. So net, so for a care management platform, the most leveraged modules are definitely utilization management, then case management, then population health management, and again quality is again most is also gaining traction in recent times.
Agreed. I think I'm also aligned in something similar, even I'm tracking as well. So, when we say utilization management, I agree prior authorization is definitely a big part of it. And a lot of the technology changes as well, we are seeing. We'll definitely unfold a lot of these technology leverage, how data is getting leverage, how analytics is getting leverage. We will talk about a lot of those in the later today in the call and in the LinkedIn live that we are having. But before that, I want to, there's a comment that I would want to make, right? In the care management space, especially in the platform space, we are seeing a lot of increased adoption being done. And when we look at platforms, I would say the ecosystem right now is very much diversified. We have your big tech vendors, big tech players out there for sure. But beyond that, what we are also seeing are two other categories. One are the typical health tech players who are just focused on the healthcare space. Maybe care management is not the only area they are focusing on. They have other areas as well, maybe patient engagement, data management, and all of that. But beyond this, the third category that we are seeing are the niche care management platform players. They are very much focused, maybe just utilization management is an area that they are focusing on. Maybe they are doing just PHM. So when we talk about a lot of these implementation of these platforms, enterprises adopting them, there would definitely be some challenges that they would face, right? So Devjit, according to you, what are some of these challenges that we see enterprises facing when we talk about implementing some of these platforms?
Agreed, HP. Agreed. So there are a lot of challenges that enterprises is currently facing while implementing care management platform. And again, I will answer this question into two parts. So firstly, I will speak about what are the operational challenges, and then I will speak about the technical challenges. So operationally, it's about workflow alignment. So many platform players, what we are seeing is they are currently underestimating the complexity of configuring business rules, especially for UM and CM triggers, care plans, and assessment logic. So this is one of the biggest pain points that I have been hearing, especially when I'm speaking with our enterprises clients, that their workflow alignment is sort of kind of neglected by the care management vendors. And coming and talking about the technical aspect, the real challenge is definitely integration. So we are at a point of time when we are sitting on huge piles of data and a lot of platforms. So we are dealing with a lot of multiple data sources like clinical data source, claims, lab records, pharmacy, and a lot of different data, right? And aligning all this data into a member 360 view is not a small thing, right? So net, if you ask me what are the biggest challenges that enterprises are facing right now, the top two will definitely be workflow alignment and platform integration.
Got it. I think I'm aligned to that, but then I just heard you mention integration multiple times, right? So what is it that makes integration so complex, or what is exactly the challenge here associated with it?
Valid question, Ashwin. And this is not just your question. I remember last week I was also having this conversation with one of our enterprise clients while we were helping them solve for this issue. But yes, having said that, each of these platforms, that is EHR, CRMs, and claims platforms, they speak different language. They all store data in different formats. They definitely, and everybody knows that they use different standards, and that is because obviously they were built at different times for different purposes, right? So for example, EHRs, they are known for clinical records, right? Like they track things like lab results, vitals, and notes. Claim systems, they are mostly for finances, right? They are all about billing codes and approvals. CRMs are focused on communication and engagement. So when you try to bring all this together in a care management platform, it's like trying to combine three separate worlds. And also, not all systems are built for easy integration. Some may not fully support modern standards like FHIR or APIs. So platforms need to create custom connectors or workarounds, and that again takes time and money, right? And on top of that, matching data correctly, like linking a member across multiple systems, can be very difficult if the fields don't line up or if the data standards are different. So, in short, it's just technical. It's about translating, mapping, and aligning data across different systems. And that's why integration is one of the most complex parts of implementing care management platforms. Because I have personally seen that some of the care management platforms might easily integrate with one system, but it fails to integrate with other systems. So, in that point of time, it is very difficult to get data from different sources. So, this is what personally I have seen most of the enterprises struggling with.
Got it. And I agree with that. And I think I have a question for our audience as well. When you talk about integration, when you talk about some of the challenges in terms of implementing a lot of the care management solutions, what are some of the challenges that you are also seeing? What are some of the are you also aligned with the challenges that Devjit and I talked about? Are there any other challenges that you would want to highlight and mention and let us be aware of those as well? I think in the meantime, till the time we have our audience come back to us, if they have any questions, any comments around the challenges side of things, maybe I would want to switch gears more towards the data side of things, right? I want to talk about what is it that some of the buzz of the town terms like data management, like analytics, AI, Gen AI, what are all of these doing, or what is the kind of role that they are playing in the care management space? I'll go one by one. Maybe we can first talk about what is the role of data in care management, and then we can move towards the analytics side of things as well.
Definitely, this is a valid question, HP. And again, as everybody knows, previously the saying was data is the new oil. But right now, it's like data is the new soil. So everything is around data, right? And as of now, if there is any platform or if there is any solution in the market which is not taking data into account, then definitely it is not going to succeed. And this is the same case with care management also. So data and analytics are really the backbone of modern care management platform. So think of it this way: data tells us who needs the care, when they need it, and what kind of support will make the biggest impact. That is what data tells us. And analytics, it helps us to turn this data into action. So, for example, we have seen platforms use data to stratify risk so that the care managers can focus on high risk or rising risk patients. Even data also helps us to identify gaps in care, like missed screening or overdue checkups. And even data also helps us to track outcomes and to see if the interventions are actually working or not. So the best platforms take all this data into account. They take clinical data, clinical notes, claims data, lab results, social needs, and they bring it together into one view. And then they use analytics to guide the next steps. That is, who should be enrolled in the care program, which members are at a rising risk of readmission, where can we improve our quality scores. So, in simple terms, data helps us to see the whole picture, and analytics helps us to do something smart with it.
Got it. Yeah, I think I'm aligned. It's all about data telling us this is what the problem is, and analytics helping us solve it and make sense out of that as well. So, completely aligned with that. I think beyond analytics, I would want to shift gears to Gen AI, generative AI. Now, when we talk about generative AI, I think it was very much a talk of the town in the last 12 months or so. Everybody was talking about Gen AI getting leveraged across industries, especially in healthcare. A lot of the use cases are the ones we saw: chatbot related use cases, content creation, personalization related use cases are the ones that we saw everybody talking about. Now, when we specifically talk about Gen AI capabilities or Gen AI being leveraged in the care management space, what are some of the use cases that are still in the POC stage, and what are some of the use cases that have moved beyond it to the to actually being leveraged and to actually become live as a use case or as a solution.
Got it. And I was expecting this question on generative AI because we can't discuss about healthcare technology without the mention of generative AI. And Ashvi, you might also agree that since last couple of years, generative AI has always been a part of almost in all of our discussion. But yes, having said that, we are seeing a mix of both live features as well as pilots right now. So I will start with what is live today or what is in production today. So the first live or production feature, no doubt, will be, and as of now, I'm pretty sure that our audience might have already guessed it. So the first feature is definitely summarization. So care managers, they can now get summaries of assessments, member histories, or clinical notes, which saves them a lot of time. And this might look like a very simple thing for most of our audience, but I cannot emphasize enough on what the improve in efficiencies that they have got. I have personally spoken with a lot of care managers, and they have mentioned that this small thing has improved their efficiency significantly. So summarization is one of the top use case that has been in production right now. The next one is on auto generation of prior authorization explanation. So generative AI is being used to draft medical necessity justifications, and this sort of paces up the utilization review process. Then definitely we have member facing chatbots that we all have might have used till now. So this is all about production. There are other different use cases also which are in production, but I won't. I'll just move into the which all use cases are in POC or pilot stage right now. So we are seeing that generative AI is also being used to develop personalized care plans based on assessment responses or clinical goals. And again, this is on POC stage. This has not moved to production. I have seen some instances of this use case moving to production, but the number is pretty low compared to the three that I have mentioned previously. And the next one is on task recommendation. So we are seeing that AI co-pilot are suggesting the next best action like follow up, screenings or referrals, and that is also based on the member data. So in summary, we are seeing some capabilities are already making care teams more efficient, while others are being tested and refined. But the momentum is strong across the board, and care management is definitely uh, getting leveraged by in almost all the areas of care continuum.
Got it. Got it. I think that makes sense. And I agree the fact that, and it's also good to see a lot of use cases moving beyond POC to actually becoming something live today. So I think the next question, and a lot of the people in the audience would have already guessed as well, is around agentic AI. I think even when we were still wrapping our heads around generative AI, how can it be leveraged? What are some of the use cases that can be unlocked? How can we solve for this? I think that was the time when even agentic AI stepped in. So, when we talk about agentic AI in healthcare, or when we talk about agentic AI in the care management space, where do you think it's going to make the biggest impact? Now, I agree that agentic AI is still not something that is very much in the life stages. I agree it's very much, it's more on the POC side of things as well. A lot of the suppliers, a lot of the demand, everybody that we are seeing in the healthcare ecosystem is still trying to understand what is it that agentic AI can do for us. So, basis your expertise, basis the market that you are tracking, and the kind of conversations you've been having, Devjit, where do you think agentic AI is actually expected to make the biggest impact in this segment?
Right, right. And again, I am also feeling a bit nostalgic because this reminds me of last year when we had generative AI in all dominating all our conversations. And now it is very surprising as well as satisfying to see that how things have changed. And it seems like all our conversation is is exactly incomplete without the mention of agentic AI. So having said that, I will say agentic AI has not yet made its mark the way generative AI has done. Agentic AI will take time. And again, agentic AI is still at a POC stage. But the areas where I feel it will make the major impact as per our research is the first area, and I'm pretty sure a lot of our audience might have guessed our first area. That is, it is going to be prior authorization. So this is where agentic AI can shine by reviewing clinical data, applying medical necessity rules, and even auto approving requests that meet the criteria. Second one is appeals and grievances. So instead of a care team having to dig through all the notes and write manual responses, so agentic AI can help them draft explanations or decisions based on policy rules and historical data. And the third one is definitely going to be member navigation. And again, HP, if you ask me personally, I feel this is going to be one of the biggest impact area if agentic AI can be properly leveraged for member navigation. So AI agents, they can guide members through the next steps. They can remind them of appointments or even help them find community resources like transportation or food support. So if you ask me, HP, so as of now, agentic AI is definitely at a POC stage, and a lot of the service providers as well as platform players, they are gauging the adoption of agentic AI through from their enterprises clients. And if they see that the agentic AI is will gain traction from the enterprises, then obviously they will be building solutions to it. But having said that, there are also a few of the platform players as well as service providers who have already made a proactive approach and have built some sort of solutions around it. But mostly it's about prior authorization is definitely one of the low hanging fruits.
Yeah, I think I agree and completely aligned as well. So before I go ahead, I just wanted to, I think there is an echo. Okay. So before we go ahead and talk more about how the ecosystem look like, what the players are doing and everything, I would wanted to let our audience know of the CTA that we are providing for this LinkedIn Live. So what we're providing is a complimentary abstract of the care management platform peak that we published few months back. This is something help that would help the audience, help the enterprises see and understand what kind of players we are seeing in the market, what the capabilities are, what is working well for them, and what is a differentiator for them, and how are they showing their value proposition. Now, given we are already on that subject, right? Value proposition, redefining value proposition, talking about differentiation features. Now, even before I go ahead and talk about that, I wanted to let I wanted to tell the audience here and everybody listening to us one common trend that we are seeing in the care management space and even the engagement space as well. When we talk about patient engagement and care management, what we are seeing is a lot of the blurring of lines happening. Like, it's not like patient engagement ends here or member engagement ends here and then care management starts here. I would say it's all the lines are blurred right now. All of it is, nothing is black and white anymore. It's all a gray space for us. So when we see players investing in their capabilities, trying to come up with differentiation features, the question I would want to understand, or the question that I have for you, Devjit, is how exactly are these care management players redefining their value proposition in a cluttered market right now? Uh, we've talked about the supply ecosystem, right? That it's quite diverse. We have your big tech vendors, we have health tech players, we even have niche care management players as well. So what is it that they're doing to make sure that they are on top of your capabilities or on top in the market right now?
Yeah, this is a great question, HP. And I will also speak from my experience of having, so as you know, right, we have worked with a couple of platform providers, care management platform providers on identifying their go-to market strategy for taking their CM platforms to the market. So based on that experience, I can answer this question. So I'll tell you what I have seen so far and how the leaders have positioned themselves. So firstly, what we are seeing is they are focusing on speed to value. So instead of having just long custom builds, platform vendors are offering modular platforms with pre-configured clinical content and ready to use care plans. And they are also offering faster go lives, especially for the most leveraged modules such as utilization management and case management. Secondly, we are also seeing that embedding AI and automation right into the workflow is also one of the secret sauce for success. That includes generative AI for summarization and auto triage, and this also helps care teams save time and focus on what matters the most. Third is they are prioritizing on interoperability and ecosystem integration. And HP, I cannot emphasize on the fact that how important integration as well as interoperability is for the payers and provider. And again, when care management solution providers, when they are offering this, that means they are offering plug and play connections to EHRs, CRMs, SDOH platforms, and even for quality tools for stars as well as headage tracking. And finally, we are also seeing that vendors are also aligning with outcomes. So they are helping payers and providers improve on their star ratings, reduce unnecessary utilization, and also close gaps in care, and not just only run the process. So today, care management is not just being a tool. So vendors are positioning themselves as an end-to-end enablers for a connected and more value-driven care.
Got it. I agree. And I think this is what is also helping them redefine or define their value proposition as well in a cluttered market like this. Completely aligned with that. I think one of the last questions I would have for you, Devjit, is we have seen how the space has evolved, right? I think in the care management space, we have seen how it has evolved, the kind of technologies that are getting leveraged in terms of, I mean, few months ago we were talking about generate. Few months ago, last year or so, we were talking about AI. Then we moved to Gen AI. Then now we are talking about agentic AI. And let's see what the future even holds for us and what is it there left to unfold as well. So, one last question for you I would have is, how have you seen or how do you expect the role of care management platforms to evolve in the coming, let's say, 3 to 5 years? What is it that is going to evolve, or what are some of the use cases or some of the areas where we can expect seeing maximum change coming in?
Right. So, as per our research, over the next few years, care management platforms are going to move from being just workflow tools to becoming central command centers of how care is delivered, coordinated, as well as measured. So, right now, most platforms, they are helping care managers to track tasks, document notes, and even close gaps, right? But moving forward, as per our research, we are seeing that the platforms will do much more compared to what they are doing now. Like, they will be orchestrating the entire member journey. That will be starting from identifying rising risk individuals to guiding them through the care plans to helping with follow-ups and social needs. They will be using AI to drive smarter decisions, like suggesting the next best intervention, predicting readmissions, or even automatically creating centralized care plans. And obviously, there will be some human in the loop because we can't directly rely on AI to prepare our care plans. But definitely, AI will. We are seeing that AI will be in the right place to do this. And most importantly, as per our research, we are also anticipating that there will be tightly integrating with payers, providers, and community services, so that the care managers, they are not working in silos anymore. Everything will be connected, starting from hospital discharge to home care to transportation. So everything will be connected. So, and we will also see that the care platforms become more patient facing, with tools that engage people through mobile application, chatbots, or even digital health programs. So, in short, care management platforms are evolving from documentation tools to intelligent, connected, and outcomes driven ecosystem that will power the entire ecosystem, and it will be a right step for moving towards the value based care.
Got it. Got it. I think this is helpful. And we also have a question. Jay is talking about if we are seeing more EHR integration happening. I think the one word answer for this would be a yes. But Devjit, if you would want to maybe talk a little more in detail about this, that what is it that we are seeing happening? I would say when we talk about EHR integration, we are seeing a lot more investments going in creating APIs that can help with the integration side of things. Because what we are also seeing overall in the market, and as Devjit and I have been talking about in the last 30-40 minutes as well, is how important integration is or what important role it plays. So that's an answer from my end. But Devjit, anything you would want to add, please feel free to.
Yeah, yeah. So HP, I completely agree with what you mentioned. But Jay, if you ask me this question, so personally, I would say that having care management platforms integrating with EHR would be the ideal state. As of now, care management platform players are trying to integrate with EHR vendors. Some have achieved success, but a lot of them have not achieved success as of now. Because see, theoretically, a lot of the platform providers will say that, hey, we are connecting with EHR. But when we are speaking with the buyer side of the market, when we are speaking with healthcare enterprises like peers and providers, we are seeing that this is one of the most important problems that they are seeing. And if care management platforms will be integrated with EHRs, then it will solve a lot of problems. Like it can auto-populate a lot of the clinical fields during utilization management or prior authorization processes. So this is one. And at the same time, see, as of now, as Hanupriya mentioned during our initial phase of our conversation, that EPA's adoption is going to increase. As of now, Jay, if you ask me, EPA's adoption is hardly around 20 to 25%, and other prior authorization processes are happening the traditional or the legacy way. So definitely, if care management platforms will have a proper integration with EHS, then EPS adoption will increase, which will be the ideal case for 2026 that we are aiming for. But as of now, I would say uh, care management platforms are trying their best to integrate with EHRs through APIs and building other custom connectors. But have they achieved success? The answer is the answer is not all have achieved.
Yeah.
So yeah, I guess Jay, I have answered your question. And Anup, if you have anything, you can add to it.
Yeah, I agree. I think what you said makes sense, Devjit. And what we are also seeing is the integration side of things. I agree that we are not there yet, but it's not like we're still way in the past. So I would say we are very much in the intermediate side of things. All right. I think with that, we would like to close this LinkedIn Live. So thank you everybody who joined us, and thank you for all the questions you asked. It helped us. It also helped us think a lot and introspect and answer your questions as well. So before we end this, I just wanted to let the team know that we have two very interesting events coming up in the month of September. One is Engage, and the other one that we have is Elevate. So we have these in Texas and Dallas in the month of September. So please feel free to click the link in the chat and you would get more details around these. All right. I think with that, thanks everyone for joining and have a great day, a great night, and a great week ahead. Thanks, everyone.
Thank you everyone for joining. Have a great day.